Most of the conversations that we have with our patients are really education-based, but we have to ensure that we understand the emotional mindset of our patients if we're going to have conversations that truly resonate with them.
For more science-based tips and tricks for you, the dental professionals, make sure to subscribe to our channel, The Dental MVP, and don't forget to hit the bell so you never miss out.
As healthcare providers, one of our primary goals is to make sure that we are compassionate to our patients. There are a lot of opportunities that we tend to miss to delve a little bit deeper to understand where our patients are at and what may be holding them back from committing to their treatment.
Let's start at when the patient arrives. You ever have the patient who arrives 20 minutes early to the appointment? You get the ding or however your receptionist lets you know that they're here, and you're like, oh my gosh, they're really early. And then 5 minutes later, they're saying, how much longer is it going to be? That's always great, right? Well, someone who is there early might have a reason for being early. And what is the reason? Usually I just get really upset and annoyed that they're early, but I don't ask them why they're early. What if they came early with that expectation that they also will get to leave early? Sure, It's not realistic, that's for sure. But we need to make sure that we're asking the questions and finding out why our patient is here in the first place.
They may have showed up early because they're excited.
Yeah.
That's so positive.
Yeah, I like that.
Excited to get their teeth cleaned.
On the flip side, what if they're late?
I mean, does that mean that they don't value the appointment? Maybe it's not super important to be at the dentist.
Or maybe something horrible happened.
That's true. Maybe they're stressed out. They were stuck in traffic.
Or they're afraid to come and it took them a long time to even vamp themselves up to get here.
Mm-hmm.
We need to dive deeper into what are the reasons for the actions that they're taking.
When you go out to greet your patient in the reception area, do you ever pause and just take a look around to see what it is they're doing? Maybe they came with a book and they're pretty relaxed, anticipating that there could be a bit of a wait. Or they're frantically responding to messages on their cell phone because this is a major inconvenience and they just need to get on with their day.
Take a look at their body language. What are they doing while they're sitting in your reception area? Are they sitting in the chair with their foot frantically tapping along? What do you think their emotion is? Are they more relaxed, like Chastity said, and reading a book? Are they chit-chatting away with the front desk individual? Or are they kind of hiding and kitty-cornered into the corner? Depending on the way that your reception area is set up, pay attention to also where they're seating within that area. If they're the first thing that you're going to see when you open up that door or walk through the entranceway, they probably wanted to be recognized right away. If they're kind of hiding, then you know what their emotional mindset might be. Start paying attention to everything from the get-go, from starting in the reception area to working your way back.
As you walk your patient back from the reception area to one of the treatment rooms, now is a great opportunity to have some small talk. If you watched our last video on small talk, it shows you some tips and tricks for delving a little bit deeper into conversations to really understand the emotional mindsets and the values of your patients as well.
Diving into these small talk conversations are really going to allow you quickly know what your patient's emotional mindset is today. Asking them, what's been the best part of your day? Well, if your patient struggles to answer that question, it probably hasn't been a great day. And it's very important for us to completely understand where is our patient's mindset right now. If they are running late, we want to know, why is it that you were running late today?
Yeah.
What got you all caught up? If it's something horrible that happened to them, they are not in a mindset to be having a bubbly conversation with you. They also might not be ready to move forward with treatment. We need to understand what is the emotional mindset of our patient right here, right now, so that we can also adapt our treatment needs to them.
As we're having that small talk, we can really start to uncover if there's big things going on in their life. Do they have a kid that's getting ready to go to college? Are they going through a divorce? Did they just have a new addition to their family? Are they doing major home renovations?
These all sound like barriers to me to moving forward with any treatment. Not always, right?
No,
but financially, that could be a big reason why someone's not going to move forward. And if we didn't have that conversation, we wouldn't know.
Yeah, and it helps us to better approach these conversations. So we can then say, I understand that you have a lot going on. I'm really looking out for your best interests in this realm, and I know that your focus is over here at this time being. And it may be enough just to kind of guide them into the conversation that you're having and making sure that they're present with that conversation.
When we talk about emotional mindsets, I want to be very clear what we mean. Emotions are something like happiness, sadness, frustration. If your patient was frustrated before they came in, well, we can move them past that pretty quickly. However, if they have an overall frustrated mindset, a mindset is what frames and dictates all of our decisions. It's the way that we process information and ensure that we're consistently sticking with that mindset to conserve energy.
A lot of times these mindset frames can be constructed by what's going on in our immediate life. Are we getting ready to go through a divorce? Did we just buy a new house? We're doing renovations. Our child's going to college, or we have a new addition on the way. These really inhibit us from looking into the long term to see what is best for us, especially in regards to oral health, and only allows us to focus on these things that are right in the forefront.
Having the ability to connect to your patient's emotional mindset is going to allow you to move much deeper into your conversations. If I can look at you and say, I understand that you're going through this difficult time, this must be very hard for you, and then be able to have a conversation that kind of brings us back around to the oral health and the importance of that and stick that into their mindset, that is going to allow them to accept the treatment that we're trying to get them to have. This is all about allowing our patients to move forward with their treatment needs without it conflicting with the mindset that they're in. Let's talk about mindset for a moment. If your patient is in a negative mindset, so they're full of fear, anxiety, scarcity, it's really hard to educate that at that time. The limbic system is actually going to be turned off. They're not going to be willing to have that conversation with you and learn about their treatment needs or any other needs, including oral hygiene instructions. How are we going to turn that on? Well, here's a couple little tricks that we could do. Stay positive, first and foremost. I feel like we're saying this a lot, but the reality is that positive conversations are going to release different hormones in the brain and allow that system to get turned on. Start having positive conversations with the patient, even if they're in that fearful, anxious mindset. One thing that you can do in an individual who maybe is more of a scarcity mindset is they're going to be kind of down on themselves and negative. If you say, hey, how did that home care go after last time I saw you? And they said, well, I was brushing twice a day for a couple days and then I stopped. Instead of saying, okay, well, why don't you keep doing it? Go ahead and give them praise and appreciation for the couple days that they did that. You want to ensure that we're giving them that positive appreciation and praise so that we're turning on those dopamine releases and allowing them to start to connect with you and be able to learn about the next treatment needs they need.
Now that you've watched this video on the emotional mindset, go back and watch our video on small talk. Taking the skills from both of these videos, really combine those to have a conversation with your patient that delves a little bit deeper to understand what their emotional mindset is.
Leave us a comment. We want to know how understanding these emotional mindsets have helped you in your conversations. Did you like this video? Make sure to give us a thumbs up and share with your friends. And do not forget to subscribe to the Dental MVP so you never miss out every Tuesday and Thursday.